Higher Learning Network. Get your hand out. We are live in the city of Chicago, right off the corner of Laramie and Harrison at Build, which is 5100 West Harrison Street. And there's someone going in now. What brings you here today, sir?
Well, coming to speak on the panel today.
And what's your name?
Whitaker.
Whitaker?
Whitaker. Yeah. 15th District Caps Office.
15th District Caps Office. All righty. Well, thank you so much for coming out and sharing your expertise today. I'm going to follow you in. Looking forward to hearing your presentation. And as you can see, this is still under construction here, but they are doing a wonderful job in the community. So if you have youth, this is the place to bring them. Or if you're a youth, right here, 5100 West Harrison Street at Build. Okay. Thank you. All right. Good morning. What's going on here today? Tell us who you are.
Earth Day. Today's Earth Day.
Okay.
So we are cleaning up along Harrison, Columbus Park, and all around up to Moore Park and back.
All right. And what's your name?
Carmen.
Carmen. And who are your other community members here?
Yes,
Or staff, I should say.
Director of Enrichment Programs here at
Hey, I'm Bradley. I'm the Chief Community Officer at Build, and I'm just here hosting and kind of being a crossing guard.
All right.
We're doing what we're doing. We got Congressman here. We have birthday happening here. We're going to have a girls event here. We got Misha Oliver and Ruth the Fruit. All these folks are going to be here. We're going to do our thing today.
All
So we're glad everybody is out.
Okay, tell us a little bit about BUILD. Is that B-U-I-L-D? What does that
That's right.
stand
It's an
for?
acronym for Broader Urban Involvement and Leadership Development. We're a youth service agency. We've been around 54 years, serving young people as young as 6 and as old as 26. So we do a whole host of programs for young people who are, whether they're gang involved, justice involved, or they're just kids who need to have something to do. So it's not just about kids that's getting in trouble, it's about keeping kids out of trouble.
Ah.
And offering hope and opportunities for them so that they can find a positive future and they can have success in their life.
Well, I am so glad you said that because 50, 40 years ago, I don't quite remember, I was an employee in high school at Build when it was on Milwaukee Avenue. Lacey Smith was my boss. Yes. Lacey Smith. Is he still around? Is he still living? He passed? Okay. Well, it's because of Lacey Smith that I know about Build. All right. So thank you so very much. Keep up the good work. Oh, but let me ask you before I leave. We have the Higher Learning Network has the Global Virtual Teen Talent Contest. Do you think any of your students who come here would be interested in that?
We actually have a performance program called Music to Me.
Oh.
We have young people who perform, they dance, they sing, they play instruments, they rap, they do all of it.
Well, we need to come and record that.
Right. We have a podcast, we have everything.
Where is it?
We do that pretty much every day.
Okay, I got to get your information because yeah, I will because we'll be back. Thank you so very much. Greatly appreciate you. And now I'm walking through. This is registration. The beautiful lady with the beautiful earrings. Hi. Good morning. Oh, 100 Black Men Inc. Let me back up so I can see this. Ah, there you go. And what's your name, sir?
My name is Eric Merriman, one of the co-chairs of the committee. How are you this morning?
I'm wonderful. What brings you out here today?
To support the community. We love to be involved, young people, and all the people that care for them.
All
So we
right.
actually have one of the people from 100 Black Men documentary presenting today.
All right. Well, thank you so very much. We greatly appreciate that. Thank you for coming out. All righty.
Now, is that Hebrew or Hebrew?
Hebrew.
Yes.
God's name, Yudhe Yahweh in English. Thank you. And who do we have here? Illinois State Treasurer. And it looks like a lady I know right there. And there she is. Hi, sweetie. How are you this morning?
Good morning.
Tell us who you are and what brings you here.
I'm Gladys Piper from the Illinois State Treasurer Michael Farrick's office. And we are here today to partner with Congressman Danny Davis on the awareness of health for all of the African American, but not only African American community, but also to see if we can return unclaimed money to constituents of the 7th District.
Yes. And if people who can't make it here today, can they go on the internet and find you?
They can go to G. Piper at illinoistreasurer.gov. And they can also go to the website, iCash, and check their names to see if the state is holding unclaimed money for them.
Okay, let me pull that up to the camera so they can see it. IllinoisTreasurer.gov-iCash.
Correct.
Claim your cash today.
Yes, and we're currently holding over $3.5 billion, and we're trying to return it back to the rightful owner and businesses.
Did you say 3.5?
Billions.
B, not an M, $1 billion.
$1 billion.
Okay, y'all better get on,
So that's why we are here today with the table set up.
All right.
Okay.
Well, thank you so very much. Greatly appreciate it.
You're welcome.
All righty, we'll see you a little later.
Okay.
And this table here is still setting up, but SUDCO, Substance Abuse Disorder Center of Excellence. Please go right ahead. And who is this lovely lady here?
Yes, Amanda Senior, I'm a licensed clinician, and also colleague of Dr. Tanya Sorrell, who's also putting together this from the Rush Substance Use Disorder Center of Excellence.
Oh, the Rush.
Yes.
Okay, I didn't see
Narcan
this.
saves lives. Narcan can save life. Find someone, just like we used to learn CPR every year at work. Now, if you see someone unconscious, it's more likely that they've had an opioid overdose than they've had a heart attack. So
Really?
It's really important right away to call 911, just let somebody know you saw someone unconscious where you are, apply, and it's just like a nasal spray. Check on them, rub them, and make sure, hey, can you wake up? If you can't, just spray it in your nostril. If they don't come around in about 2 or 3 minutes, use the other nostril. There's 2 in each box. And even with fentanyl, it works to remove and reverse an opioid overdose. Literally, with the highest rate, this medication is one of the most likely to be able to save a life. If there's an opioid overdose, almost 100% of the people that use it, if they're still alive, can reverse that opioid overdose. We don't have a medication that helps save lives better than Narcan.
Wow.
Everyone should have one in your home. It's going to be available over the counter this summer, but that still may be an obstacle for some people. We have Narcan free to distribute to the public at Rush, Substance Use Center of Excellence. Reach out to us. We'll be happy to reach out to you. Come and talk to your community, organization, church, location, or school, and train, discuss, and educate you on substance use prevention. We're getting recovery because frequently people don't feel they can reach out to get help. Help is available, and we're here to help.
All right. And is there a website people can go to or a phone number they can call?
Yes, we're at Rush, RUSH, at rush.edu. Or if you look at our website, Rush Substance Use Center of Excellence, we're right there, and you can reach out to us anytime. I'm Tanya Sorrell, the director of Rush Center of Excellence.
All right. Thank you so very much. We definitely get this information out to the community. Thank you, and we'll see you a little later.
Take care now.
All right. Thank
Be
you.
safe out there.
Thank you. And always do what?
Always carry Narcan.
All righty. Thank you so much. Greatly appreciate that. And we're going to flip to the other side. Who do we have here?
Good morning, I'm Kim Robbins with the lobbyist of the National Retirement National Land Nurses Association. We're very active in supporting good policy that protects the public and promotes nursing. Just to let you know that next Wednesday there's a bill that's going to be brought up into committee, set Senate Bill 1779. 1779 is licensed medication aids, and the licensed medication aid is going to replace the nurse in long-term care giving medications to nursing home residents as delegated by the RN. We believe that is a very unsafe and dangerous substitution for licensed, educated nurses. We understand that there needs to be more staff in nursing homes, but they have to be qualified, educated, licensed staff. So this is just a little bit of an example of what nurses do, the 8 rights of medication administration. These are taught during nursing school. When you have someone who doesn't understand nursing or pharmacology, they are not going to be able to do anything except pass a pill. There is an assessment component to medication administration that requires nursing knowledge. Nurses go to school for years to be able to understand and assess a patient's needs, and passing the pill might not be what they need to do at that particular time because it's assessment. So we would like the public to be able to go to the website on www.ilga.gov and to be able to file a witness slip opposing Senate Bill 1779. These are the instructions as to how you find the bill. And actually, if your camera can pick up this code and hit, that's a QR code, you'd be able to go right to the web page to be able to, I think you have to, if you click it.
But I'm live.
I know you are. So this is what the bill is. That's what it would look like. Those are the parts that you need to fill out. If you have any questions, go to the website for our Chicago Chapter
Is that the correct information?
Association. Okay. And I'm Pam Robbins. Just to let you know that all of our website has our fact sheets and our instructions on how to slip the bill against Senate Bill 1779.
Senate Bill 1779.
Oppose. Yes.
How can I keep that?
You can.
Okay. All righty. Well, thank you for the information.
If you'd like to be able to call me later, and we can put that on the your
TV show.
TV show.
It's live now.
So I can be able to do that. So that's very
And I can
important.
send you the link after.
Absolutely.
Okay.
Thank you
All right.
so much.
Thank you so much, Pam. We appreciate you. Hi, sister. Are you with her together?
Our policy, yes. Our policy, Dr. Decker. Dr. Decker, Trailer, yes, live and policy.
I know Pam gave you a good orientation on all our forms we prepared for the public and nurses and legislators. We need to make sure we teach our nurses and our community about what's going on in healthcare and dental, all these other professions that are free. People are not woke yet. They need to get woke, like they say on TV. Okay, and so we can fight together for policy that's important to us and our community.
All righty. Well, thank you so very much. We greatly appreciate that. We'll see you inside.
All right.
All righty. Thank you. All righty.
This is the other part of the Chicago Chapter, National Black Nurses Association. We were the first chapter chartered in Illinois. We now have 6 chapters that are in Illinois. And we will be celebrating 50 years as a chapter in October.
Wow. Congratulations.
October 20th, 21st, and 22nd. And we're going to have a big celebration. My name is Ethel L. Walton. I am the city president of the chapter at this time. This is Miss Vanessa Willis. Hi. She is the vice president.
Hi, Miss Vanessa. Glad to have you here.
So, and of course, we do health fairs, we go out in the community, we gave out hand sanitizers, we give out information about COVID, we do blood pressures, we get our blood pressure come here today in case of emergency, blood pressure taken. And we would like to let the community know that we come to churches, we do talks
And how can people contact you?
Well, we have a website. We don't really have a phone, but we do have a website.
And that is
Chicago Chapter National Black Nurses Association.
Chicago Chapter Black Nurses Association. That is
National Black Nurses.
National Black.
And the acronym is CCNBNA.
All righty. Oh, okay. Celebrating 50 years. How about that?
Yeah, that's
Chicago National Black Nurses Association Chicago chapter happening at the Oak Lawn Hilton, 93rd and Cicero, October 20th to the 23rd. All right. Well, thank you for sharing this information. Can I keep this?
Yes, ma'am.
Okay, wonderful. And then,
Definitely, and look, spread the word.
that's exactly what we're doing. Oh, this is another one too. Chicago chapter. Save the date.
Yeah.
1973 to 2023.
Yeah, we're having a weekend event. Saturday is our big gala. Friday night we're having a meet and greet, and Sunday we're doing an ecumenical service and sending our fine attendees home.
All right. Well, thank you so very much. We greatly appreciate that, and we'll see you inside. All right. Thank you for sharing. Bye-bye now. And ask us about starting prep today at Cook County Health. Good morning. How are you, sir? Tell us a little bit about Cook County Health, one pill a day or an injection every other day to prevent HIV.
So I work for Cook County HIV Integrated Program.
What's your name?
My name is Gregory.
Okay.
We work in HIV prevention, care, treatment, and research.
Uh-huh.
And so what this is about right here is PrEP, and PrEP is pre-exposure prophylactics. And so ideally it's either one pill a day or an injection every other month to prevent the transmission of HIV. So it'll prevent somebody from acquiring HIV, along with, the standard, condom usage and things like that. And so then we have a phone number here down at the bottom that anyone can call to get access and refer to any of our community clinics.
Can you just say the number?
Yep, the phone number is 312-572-4515. Again, that number is 312-572-4515, and they can get connected to any of the clinics throughout the Cook County Health System. And so we have some in the south suburbs, we have some in the far northwest, and then we have the ones on the west side of Chicago, primarily Austin Clinic, Austin CBC, the Ruth and Prostate Care Center at Harrison and Davis.
All right. Okay. And you have information packets for the people?
Yeah, so we have information, we have condom packets, we have information about HIV/AIDS and other STIs, and then we have information specifically about PrEP right here that people can take. So they can remember the phone number so that they can call and get links to services.
All righty. Well, thank you so very much. You've been very helpful.
So
What's that website one more time?
The phone number is 312-572-4515. Again, 312-572-4515. And then we have clinics throughout the entire Cook County system in South Suburban Cook County areas. And so we can link people anywhere closest to their home or where they want to be linked to.
Well, thank you so much. We greatly appreciate that. All right. And we're coming up to Gin Care. And of course, I've got to go to the Higher Learning Network, where we offer for Black mental health. We have free mindfulness breakthrough system. It's in paper form today, and it's free and open to the community. It's free, absolutely free of charge. Beginner's Guide to Mindfulness and Diabetic Donut, how I reverse type 2 diabetes, as well as the Global Virtual Team Talent Contest. And that's what we have here. And we're going to mosey on over to another table, which is Gin Care. So who wants to tell me about Gin Care this morning?
So Gin Care is a senior medical center. We have 6 locations in the Chicagoland area: Berwyn, Ashburn, Oak Lawn, Jeffrey Manor, Dalton, and Glenwood. We specialize in providing senior care, and it's VIP senior care, where you have your primary doctor on location, along with other specialists on site, so you can do everything at one location. We offer VIP transportation, door-to-door transportation. We offer acupuncture for our patients. So our overall goal is to basically do preventive care for our seniors, and ultimately they live long and they're able to engage with their families.
And that's the name of the game.
Yes.
All right. What do we have here on the table?
So we have crossword puzzles. We also do a $25 monthly grocery raffle for our seniors. We also do different events, like we have a tourism tacos coming up to celebrate Cinco de Mayo, because we keep everything diverse. We include everybody. And then that's our monthly calendar of some of the events that we do offer at our center. And then this is a brief description of everything we do offer at all of our convenient locations.
All right. There's one in Ashburn, Glenwood, Berwyn, Jeffrey Manor, and Dalton.
Yes, ma'am.
Oaklawn.
Yes.
Already. Better health care for seniors.
Yes.
And
VIP service.
And who's this lady here?
I am Karen Jimenez. How are you?
I'm good, thank you, Karen. And you're part of Gen Care
Senior Medical Center.
as
And
well?
then Brenda also mentioned one of our doctors is speaking today, so Dr. Martin is one of the speakers today.
Oh, okay. What's his name again?
Dr. Martin, she's right behind us.
Oh, there she is. Oh, one of the doctors at Jeffrey Manor. So, can you tell the camera, or I should say the audience, who you are and what you're speaking on today?
Yes, so I'm Dr. Alexa Martin. I'm a board certified family physician, and I'll be speaking on chronic diseases and longevity, which is a big topic.
Chronic diseases.
Chronic disease.
All righty. Well, if you would like to step over to the table right there and take any of that information, it's free. Everything there is free. And maybe give one to your patients. I don't know. Everything is free. Everything is free. So we're here to share the good news. Thank you so much. Greatly appreciated. And last but never least, she's live right here. It's Habilitator System. And we've been giving your number out all day, but excuse me. So I'm sorry. I thought you saw me with the camera, so you would assume. Okay, so tell us who you are and what you offer.
Okay, I am Jermaine. I'm the community outreach person for Habilitated Services. We are located at 415 South Patrick. We render a lot of services to community members, whether it's through mental illness. We have a reentry program in housing if you're being released from prison, and yes, we have a lot of great services. We offer food programming, things of that nature. We do a lot of mental health, such as meditation and yoga. It's a variety of things. I can't think of everything off the top of my head. But yeah, 415 South Patrick, Habilitative Services. They've been around since 1978. This organization is just amazing.
I know, and I'm always telling people about Habilitative Services. I met you and one of the other reps at Westside Medical Store this year.
Yes, absolutely. So make sure you take one of our bags with information on it.
Alrighty, take one of these. And
is
the yoga class in here?
Oh yeah. Oh no, you can take one. Take an extra. Yeah, I just received those flyers.
Okay, good.
All right.
Definitely want one of those. I need to be there. I may not do what they do, but I can do my version of it.
Oh, thank you so much, man. Appreciate it.
All right, thank you. Alrighty now, we've got people going in. And people out here gathering, having conversations. Is this a mic check?
I have no idea. I'm just standing right here.
Okay. All right now.
I haven't heard that in a long time. A long, long time. When my kids were little.
Okay.
Now they're 40 years old.
Well, as you can see, people are still coming in to build hope, lives, and futures. And we got the DJ up here. They're doing sound check.
Let me hear my one. Check one, check two.
Oh, we got a buzz. They'll get out. Hey, Mr. DJ. All right now. Dr. Terry Mason. Morning, y'all. Good morning, good morning. People are still coming in. There's Dennis from Nurses Association. Hi, Dennis. How are you today?
I'm good. How are you?
I'm wonderful. Aren't you with the Black Nurses Association? Tell us who you're with.
I am a member of the Chicago chapter National Black Nurses Association, but I also work at Loretto Hospital.
Ah, okay. You've been there for a while, haven't you?
15 years.
Yeah, that's a pretty good thing. And what have you what have you seen in the community change over the years as it relates to our mental health?
Well, first of all, a lot of times people had mental health issues and we didn't even know that they had mental health issues. Also, people had health care. They had access to mental health facilities, and now that's gone. So that's the difference.
So what do people do when they don't have mental health care? What do they do? Where do they go? Who do they call?
So Loretto Hospital is a safety net hospital that handles people with mental health and substance abuse issues and all of those things. A lot of times our mental health issues are due to substance abuse, misuse. So Loretto Hospital is one of the safety net hospitals and certainly the only hospital in the Austin community. But we are a safety net hospital, and that is what we do. We deal with those issues.
All right. Well, and is there a number or website that people can contact you at if they need more information?
So the website for Loretto Hospital is www.lorettohospital.org. And if you want to reach us in the community health department, it is 773-854-5063.
All right. Well, thank you so very much for sharing this information. We greatly appreciate it and your contribution to the community. Thank you so much. Anything on the table is free. Anything and everything. And this is the young man. Aren't you the one that helped me this morning? Yeah, I borrowed your knees. Yeah, he got them good knees because I couldn't get down there on the floor and plug anything. So in honor of that, please take anything off the table. Everything is free.
How was everybody speaking? What is this about?
This is healthcare and black mental health.
Black mental health?
Yes, because we need all the help we can get because they've closed.
My name is George. I'm from Atlanta, Georgia.
Oh, Atlanta.
Yes.
Oh, wow.
I'm currently an early intervention specialist at Cook County Jail Reform Center. I feel like black mental health is very pertinent for us as well as the youth because our mental illness is limited and we have to take care of it.
Okay. Wonderful. Thank you so much for sharing that. Greatly appreciate you. That was wonderful. You're a one take wonder. We're live on Facebook and YouTube and other channels too. Thank you so much. Good morning, sir.
Good morning. How you doing?
I'm good. Are you a speaker?
I am.
What's your name?
I'm Dr. Matthew Davis from Lurie Children's Hospital.
From whose hospital?
Lurie Children's.
Lurie's, really? And what is your expertise?
My expertise is in pediatrics and community health.
Do little bitty people have mental health problems? Really? How so?
Well, what happens is when kids are growing up, we understand that younger and younger, we can see the signs of mental and behavioral health concerns at pretty young ages, as early as 1, 2, 3. So we have to be aware of what those signs are like and work with the parents or other family members, other community members to help those kids out.
So can you give us an example of what one of those signs might look like?
Yes. For example, yes, for example, if a child has tantrums when they're 2 years old, we call that the terrible twos, and we expect that. Okay, but if they're still having tantrums when they're 3 and 4, that means they're having trouble with something called self-regulation. They're having trouble making transitions from one activity to the next. And that's not a problem of attention, that's a problem of emotion.
Okay.
And so when we see that, if we're a parent or an auntie and uncle, we see that, we need to try to see if we can get that child and that parent some help in terms of figuring out how to help that child emotionally and set themselves up for better help in the future.
Okay. Well, thank you so very much. We greatly appreciate that because if I didn't know, I'm sure there's somebody else that didn't know.
It's great to be here today, to be part of this great event.
And thank you for coming and sharing your expertise.
You bet.
We appreciate you.
Thank you.
Feel free to stop at the table and get anything. Everything is free. Anything you want.
Thank you.
Except for my laptop.
Very nice.
Nice to meet you. Please take a card. Can we please ask you to
My hands on you.
Where did he go? There he is. Nikki says to ask, to ask everybody to come into the audience.
Okay.
And I think a man's voice would sound good.
Okay.
Thank you. Oh, I didn't get one of these.
Absolutely.
Thank you so much. the whole community on the last table. I got plenty of cards and flyers. Everything is free. The last one. Take anything you want. It's all free. Yep. Everything's free. Everything. Yeah. Yep. Everything is free. So get whatever you need. Share it with the community.
Good morning, everybody.
Good morning.
This is not our home. This is not my home. This is our home. And we are so grateful that you all can be here today, that Congressman Davis has requested to do this special event here with us. This was built with the intention of bringing this as a home to our residents, folks who live here in Austin, and folks who don't even live here. This is a home for young people, it's a home for adults, for seniors, programs that we're bringing online every month. So we want this to be utilized as public spaces, as a youth center, as a community center. We hope people can enjoy the facilities. If you get a chance, please do go for a tour. We have maps at the front, walk around, see all the cool spaces that we have. We have several events happening today. We've got a Root to Fruit is hosting their Women in Mental Health Conference. It's for girls. They'll be doing their conference here, along with birthday that we have happening here on site at Bill, and of course, it's Focus Park. So thank you for coming into the community's home, and I want to introduce you, of course, with needs no introduction to Congressman Davis. Thank you.
Well, let me add my words of welcome to those of Alabama and express our appreciation to him, his board of directors, his staff, the donors, all of the individuals who helped to put together this magnificent program and project. Brand new $23 million facility right in the heart of the community where I lived, right across the street for 20 years. I lived at 5252 West Oak Street for exactly 20 years. And the only reason that I moved is they redistricted the area 2 blocks and put it in the 4th Congressional District, which was Louis Gutierrez's district. And so when I ran for Congress, I voted for Louis Gutierrez because I was no longer in my congressional district. so I moved, but that's the only reason. This community and this spot, this piece of ground, has a great deal of history. As a matter of fact, it used to be the headquarters for the United Auto Workers, who were right here, and they have been one of the most effective unions ever created in the United States of America. As a matter of fact, they invented the strike. They were the first union that created and started using the method of striking in order to get the information or to get the movement or get the action. Then we had Shorbank. I was able to attract Shorbank here for a fellow named Milton Davis. And I figured that since his name was Davis, and I was a member of the Chicago City Council at the time, they wanted to expand from just South Shore and move to other parts of the city. And I suggested to them that they moved to the west side. And they came to the west side and established a branch of Shobank right here in this community on the west side of the city of Chicago. Moving forward, the latest acquisition that the area has been able to get is the mayor of the city of Chicago. Because now Brandon Johnson, who is the mayor, lives right down the street from you. And so we are bubbling over with community pride and with the fact that the city of Chicago is becoming more self-producing. I won't give you a lesson in terms of the evolution and development of Chicago, which for those who don't know, is still the greatest city in the United States of America. And just a couple of weeks ago, maybe less than a couple of weeks, the National Democratic Party decided that the 24th convention is going to be in Chicago, and we're bubbling over. Yeah, those conventions actually bring millions and sometimes even more money into a place. You get 50 or 60,000 people who come into a town and they didn't live in that town. They all bring money. They all have to find some place to stay. They all have to meet. And they generally bring a little extra money on other things. And because of that. So let me thank all of you for getting up on a Saturday morning and coming out to share with us as we talk about the state of Black health, period, and most specific in Chicago. I'm going to ask the panelists if they would all come and join us up here. And I think you know who you are, but if you don't, I will call off your names. All right. Of course, Dr. Kingsley, President of the Cook County Physicians Association. All right. The Cook County Physicians Association, and of course, I'm sure that all of us know the value of groups coming together. And we have had such a tremendous group of African Americans who have served in the role of physician in our county. I think of people like Daniel Hale Williams, who did the first open heart surgery and was really the guy that started Providence Hospital, and of course started training Black nurses at Providence Hospital on the south side of the city of Chicago. So we've just had right down through the line a tremendous number of outstanding surgeons, family practice physicians, obstetricians, gynecologists. I remember I used to work with Dr. Steptoe, who was the head of obstetrics at Mount Sinai Hospital. And I worked there for a little piece. I actually worked for Mount Sinai Hospital and had a wonderful time because we started the Martin Luther King Health Center that ultimately is no longer in operation, but an antecedent of that is Access Healthcare, which actually started in conjunction with Mount Sinai Hospital. It is the largest of all the federally qualified health center programs in not only Chicago, but that you will find anywhere in America. And of course, I'm a big fan because I worked at Martin Luther King when there were only 10 federally qualified health centers in the United States of America. Now there are more than 2,000, serving more than 30,000 low and moderate income patients all over the United States of America. And we often say they undergird primary health care in this country. So help me welcome the head of the Cook County Physicians Association, Dr. Tanksley. Please come.
Good morning, everyone, and thank you so much for being here. Again, my name is Dr. Audrey Tanksley, and I'm not going to take up a lot of time. I'm just going to give us a few words on why, what, and what we're doing and why we're here, and a little bit briefly about our organization. Cook County Physicians Association, or CCPA, was founded in 1911 and is the local chapter of the National Medical Association. The National Medical Association, or NMA, is the largest and oldest national organization representing African American physicians and their patients in the United States. The NMA represents the interest of more than 50,000 African American physicians and the patients they serve. We are committed to improving the quality of health among minorities and disadvantaged people through professional development, community health education, advocacy, research, and partnerships with federal and private agencies. Whenever the conversation surrounding Black health is discussed, the narrative that emerges is Blacks have shorter life expectancies than non-Blacks. The top 5 contributors to this gap in Illinois are touted to be chronic disease, homicide and violence, HIV and other infections, infant mortality, and opioid overdose. But this is not unique to Illinois. Of 500 US cities, 56 were found to have large life expectancy gaps, while Chicago holds the title for the largest life expectancy gap at 30.1 years, measured by Streeterville, which has a life expectancy of 90 years, while 9 miles away in Inglewood, people live to 60 years old. DC, however, was not too far behind with a gap of 27.5 years, followed by New York City at 27.4 years, New Orleans and Buffalo tied at 25.8 years. The common theme, however, with all of these cities was that each had a high amount of poverty and segregation. What we don't address is the fact that racism is a public health issue. Race in the United States health system is one of America's biggest dilemmas. The human consequences are abundant and apparent, yet the effects are rarely acknowledged and often downplayed. Race is important in American health and healthcare, whether viewed from the perspective of racism affecting clinical decision-making, or white indifference to the African American health emergency, or continuation of barriers that limit African American entry into the profession, or the unfair and biased treatment after Blacks become physicians, dentists, pharmacists, nurses, and other healthcare professionals. We are here today to change this narrative and create solutions to the disparities that we know have existed for years. Illinois, mostly led by Chicago, has always been a mecca for innovation, transformational change, and big ideas. We are the home and the organization of the first open heart surgery. We are the home of our ancestors before us, and like them, we must usher in a new day, one with respect, intention, and healing. Last week, a study was published in the Journal of the American Medical Association that showed on average, for every 10% increase in Black primary care physicians in a county, Black patients live 31 days longer, concluding that Black patients do better with Black physicians, but there are not enough of us. Congressman Danny Davis is a vanguard on healthcare. For over 30 years, he has been an advocate of health equity and decreasing disparities. He created the first federally qualified health centers and the bills that continue to provide funding for the safety net institutions. The Congressman has a deep commitment to the community health as he has orchestrated tours throughout his district to bring men to the table and educate them on women's health. He specifically taught them about fibroids, an unspoken disease that causes significant burden to Black women and families. Congressman Davis has mandated increasing the number of residency slots available and fights for a diverse workforce. He has increased funding for sickle cell, which has been under-researched for years due to inadequate funding, and he has addressed social determinants of health by increasing funding for child care and for second chances. I would like to thank Congressman Davis for inviting CCPA to be a part of this conversation, and more importantly, empowering us today as a part of the work group sessions. As you can see by his work, the Congressman is about action, and that is our focus today. Many of us have gone to the Hill, but how many times have we had the Hill come to us? Today is historic. There is no hill. Instead, it is all level ground. This is democracy in action. This is the advocacy that each of us vow to do as professionals for our patients every day and for each other. So as we say, be the change you want to see. Often very few show up, but I thank you today for showing up and encourage you that today we're going to be that change. So I want to orient us to what we're going to do today. There are going to be 8 breakout sessions. Those 8 breakout sessions, I'm going to list them off because I'm not sure if everyone was able to register. But if you've pre-registered, then you've already chosen the session that you wanted to attend. If not, session 1 is called Food is Medicine, the Real Nutrition. The scribes for these sessions. So the scribe for session 1, Food is Medicine, the Real Nutrition, is here. She's going to be at this table to the left. Session 2. We have a scribe for session 2? Okay. Session 2 scribe. The session 2 is Safer Shop, Violence in Our Community, a Public Health Problem. So we're going to have session 2. So just so you guys know, just a little bit of, in case you haven't seen the agenda already. This morning we're going to have breakout sessions from about 10:30 to noon. So those sessions will be facilitated by subject matter experts. You will be able to talk amongst each other, discuss the issues, and to come up with, and you're not on the spot, so please don't feel like you're on the spot. But our ask of you is that you come up with solutions that can help amend existing policy or create new policy. Policies that are anti-racist and equitable in the areas that impact the Black community the most. So that's what these sessions are. We'll have lunch after the sessions. You'll have an opportunity to engage with the resource fair that's here. And then after lunch, we'll reconvene together. We'll do our share outs, and we'll also have our panel discussion that brings everything together and discusses next steps. So that's the flow of today's event. The sessions are going to break out. Each session has a scribe who will take notes for you, so don't feel worried that you have to take notes. We really just want you to be part of the think tank, and then you will need to choose a reporter, someone who will report out. Otherwise, this is really more of a convening of the minds. So session 1, Food is Medicine, the Real Nutrition. Session 2, Safer Shop, Violence in Our Community, a Public Health Problem. She is in the hallway because Safer Shop is going to be listed, is going to be in one of the breakout session rooms. Session 3, which will actually be here, is Mommy and Me Aren't Doing Well, Maternal Health and Infant Mortality. So if you are interested in session 3, Mommy and Me Aren't Doing Well, it will be facilitated by Dr. Elam. That session will take place to my left. Session 4, Let's Talk Healthy Bedroom Business, Facts Fiction and the Road to Zero. This session will focus on HIV and other diseases. It will focus on healthy sexual behavior and issues. That is going to take, that scribe is also in the hall because that is also going to take place in a breakout room. So there are a few sessions that will be here at tables and a few sessions that will be out in an actual room. Session 4 is in a room. Session 5, the Black Blues, mental health and opioid overdose, the doctor's overview. That session will take place in the back of the room. The scribe will be present. That session will be facilitated by Dr. Donald Du, myself, Dr. Tanya Sorrell, and so we'll be located at that table there in the back. Session 6 is Let's Change the Narrative, Life Expectancy and Chronic Disease. That session is going to take place also in one of the breakout rooms. It's on the second floor. You can meet the scribe in the hallway for life expectancy and chronic disease. Session 7, Growing Up, Youth and Adolescent Health. That is going to be facilitated by Dr. Sylvia Robinson. That session is going to take place in the back of the room. And so if you are interested in pediatrics, youth, adolescent health, that session is taking place in the back. And then our final session is session 8, Health and Manpower Needs. This is a session after the Congressman's own heart, speaking about workforce shortages, and will be facilitated by Dr. Bill McDade and Dr. I'm sorry, I don't have your name, but one of the doctors from the Black Nurses Association. Thank you, Dr. Mildred Taylor. Yes, Dr. Mildred Taylor, Joseph Harrington, Tessa Anowishki will also be facilitating. That session will take place to my right at the table in the back. So I'm going to read those sessions again just for those of you
And as you can see, my other camera went out, so I had to go get my laptop. Hi, please take anything. Everything's free. You thought I was talking to you? I'm live. Okay. So my camera went out, so I had to come and get my laptop. And we'll record from there. Thank you for whoever you are. Type in what city, state, or country you're watching from. And I'm gonna try to go back in here. And they're waiting for me. So this is what's going on around here. They're in the break-off sessions now. And my camera went out, so I'm going to put my laptops so y'all can hear what's going on. My camera went out, so I had to go get my laptop. Okay.
No, this is everything. You too.
Hi guys. My camera just went out, so I had to go get my laptop. So you're still live on Facebook. So whatever you're talking, say it a little loud.
Okay. So these are the things that when you start talking about food, at least the doctors want to call it heart disease. But that's not the problem. Actually, there's usually absolutely nothing wrong with the heart in the beginning. And the problem is that what we don't do is give people the truth. That if you got arteries that are blocked on your heart, they're blocked in your head, they're blocked on your kidneys, they're blocked in your feet, they're blocked all over. And so that is the biggest problem I have with the nomenclature that we've been told to use, because it doesn't speak in the totality. And foods and medicines, and I'll shut up after this, everybody wants a medicine that does a thing.
One thing.
Does a thing.
Yeah.
I got pain in my knee. So I want that pain to go away in my knee.
Yeah.
But that's not how medicine works. And that's not how food works. Medicine is a solo, food is a symphony.
Ooh, say that again, please.
Huh?
Say that again, please. Somebody didn't hear that.
Okay, medicine is a solo, food is a symphony. Because food does a lot of things all at the same time. And we eat the best food, which is why whatever time I got left on the planet is going to be dedicated to growing the best food that we can eat.
I agree.
Because if we ate the right food and drank enough water and moved, we wouldn't need no medicine.
Yeah. I think that when we talk about food, we have to talk about this food that's good for you. But there are also some food that are not, that are harmful if you consume too much of it. So we need to look at both aspects of that. Many of the problems that we consume, as he was speaking about people with artery disease, with the coronary artery disease, or any disease where there's blockage in the artery, is related to high cholesterol and some other issues that may exacerbate the thing that cholesterol does, because further injury to our blood vessels. So when we learn to eat, we have to really reassess what we're eating and why we're eating. Obviously, we need food for energy, but we also need food as nutrition for our bodies. This is a complex organ system that we have.
Of course.
And it requires things that will help it to grow, develop, and to maintain it. Once you get to the point of maturity, it has to be maintained.
Yes.
If you got a car and you decide that you're going to put kerosene in your tank as opposed to gasoline, you have some problems pretty soon. You're going to have a non-functioning car.
Absolutely.
But the same thing with our bodies. When we decide to put a lot of sugar and a lot of fat and things that cause our organ systems to cause our vascular system to get occluded or blocked up, then we're in for problem. So we need to sit down and really analyze it and figure out how much we need of what.
Yeah.
And when you go to the, I always say, when we talk about people being overweight, you don't go to the to the gas station and just continue to let the pump run. Once the tank is full, you cut it off.
Yeah.
You don't need it anymore.
That's true.
So same thing.
That's going to be a problem.
So the same thing we have to do with food. I mean, even the food, even things that are good for us, we have to be disciplined enough not to overdo it.
Yeah.
You can drink too much water, and it can be harmful. Yeah, there's something called water intoxication.
Wow.
Yeah.
Everything, there are requirements and needs that the body has, but those are defined. And we don't need to go over what our needs are.
Yeah.
Just like I said, when you go to the gas station, if you don't put gasoline in your car, it's not gonna run. I don't care how good it is, how much it costs. But if you put too much in it, you're just wasting your money because it's gonna run out of the tank. So the same thing when you eat. So you want to overeat, but you want to eat the correct amount and the proper things that you need. Like I said, if you need gas, you put gas in the car. You need water, you drink water for your body.
That's true.
You need certain nutritions. Make certain that you get those things. And those things that cause damage, we have to make certain that those things are not a big part of our diet.
Yeah.
And we're here today because we've gotten to a situation where we're living in a time when there is so much going on, so much sickness, and I think that we at least I have, after practicing 40 years of medicine, internal medicine, come to an understanding that, some of the ways that we were trained and to do are maybe not the best way that we're going to be able to help people.
Yeah, but you got to remember, Jay, in that training of 4 years of medical school, we had 40 minutes of nutrition. 40 minutes in 4 years.
Yeah.
And that was really nutrition. It was about deficiency diseases. It was about scurvy, and beriberi, and iron deficiency, anemia, that kind of stuff. It wasn't really nutrition. Let me just say this, and James, I'm not going to...
go ahead.
But there is no profit in health.
Do y'all understand what he's saying?
Oh, I understand.
There's no profit. We can't make money with healthy people.
Yeah.
You only make money. The pharmaceutical industry is thriving on, because I'm going to tell you, doctors have been trained to be arbiters of the pharmaceutical companies and the device manufacturers.
Teach.
That's just the truth.
Yeah.
And what do I mean by that? And what I'm saying is, they don't want us to learn. There's not one medicine that I have or you have prescribed in the 40 years of medicine, and mine are not much shorter than that, that cures one thing. There's not one medication. It manages a disease. You can take blood pressure medication, and you should if you have it, all your life. And it'll make the numbers better, but it's not going to ever clean up the underlying cause of why you have high blood pressure. The same thing is about diabetes. Same thing is about all this. I'm not saying don't take them, but we need to understand what their role is. And if you look at it, look what happened with insulin. Insulin prices shot up through the roof. Remember that?
Yeah.
And let me tell you something else. Do you know, if you walk to a drugstore looking for items for constipation, you'll see a whole wall of stuff for constipation. You know how much Americans spend annually on medicines, over-the-counter medicines for constipation? $7 billion.
Wow. Yeah. I think one of the things I think we, in order to try to, help our people, is to try to get at the root cause of all of the things that's dysfunctional. And I was sharing with Dr. Miller, I think that a lot of our people don't understand the difference between naturopathic medicine and allopathic medicine. And so there's a problem there in itself right there. And you're right, because the drug cartel, as far as the pharmaceutical company, is there to make money. And that's their whole purpose. Now, one of the things I did study was Rockefeller and his approach on the medical community. because we're talking about Rockefeller, I'm talking about the old man, he really set kind of the curriculum for the whole medical community down through the years, because I studied some of his theories, studied some of his approaches to why he does it. So he takes a monopoly upon all of these things to change the structure of medicine. I do know that one of the things that we have in our context, if I can say that, is that we have a lack of understanding and a lack of not understanding the function of our bodies and what God has placed our bodies in. Because the Bible does say that we are wonderfully, fearfully made. So then if we're going to kind of take another approach in trying to straighten this out, then we have to get back to see what God has said about it. So then if we have these problems in our body, number one is that because there has been a violation of what God has said. So when you have a violation of what God has said, then you suffer the consequences of that violation, right? And that violation is that because we have a problem with processed food, and so then and as I've been looking at this and studying, because I was sharing with my friend Dr. Miller, and one time I wanted to be a doctor, but he didn't let me be a doctor, he let me be a preacher.
Another kind of doctor.
Yeah, another kind of doctor, soul doctor, soul doctor. So then when you have irritation, then you have inflammation. Then when you don't have inflammation, then you have dysfunction. And so then part of our problem is that
inflammation.
Yeah, right.
Cause dysfunction.
Absolutely. So you have that problem. Yeah. And then so then it's like I said, trying to get people to understand the food industry, and they're there to make money.
I got a question.
Here we go. Yes, sir. Yeah.
What does Genesis 1 say? The first book of the Bible, first verse.
Well, it says that I wrote it down because sometimes I forget, because what he says that the herbs are for the healing of the nation.
He said, I give you every seed-bearing plant.
That's right, right.
They shall be yours for food.
Yeah.
Now, who is saying I? Who's the I?
God said it.
All right. And
Yeah.
he said, and who's the you?
Me and you.
All right. And he gives us what? Every seed-bearing plant.
Right.
Then he says, he didn't say, think about it. He said, they shall. Shall is a command.
Not an option.
It's not an option.
Yeah.
Is that right?
That's true.
I'm just
No, that's true. That's true. The Bible says that.
And our reason that we suffer is because we have deviated. Because when you buy a car, you get a manual. And the manual says, this is the quality of gasoline you got to put in that car. And if you're supposed to put 92 and you try to put 87, it's not going to run right. Is that right?
Absolutely.
So now our manufacturer has told us what to put in our bodies. And we have deviated from that. And now what are we? We're sick as hell.